So good afternoon. Today we're going to give an update on our plans to continue to support school districts, administrators and teachers here in the Commonwealth and kids with respect to COVID-19 testing resources. But first I want to give a quick update on the COVID-19 testing cases and hospitalizations here. The Department of Public Health yesterday reported over 19,500 new individuals who've been tested for COVID-19. As we said earlier this week, we've seen a steady and consistent increase in the number of people tested compared to the spring and early summer. Yesterday, there were 262 new positive cases reported, which brings the total since the beginning of the pandemic to 115,048. The 7-day average test for positive test rates in Massachusetts remains at 1.4%. There are currently 365 patients that are hospitalized for COVID-19 statewide, and 66 of those are in the ICU. Those are pretty similar to the numbers we've had for the past couple of weeks. As of yesterday, 2 hospitals are using surge capacity. Yesterday, DPH also issued its weekly update to our enhanced COVID-19 community-level data map. That data can be accessed on DPH's weekly report or at mass.gov/COVIDmap. The new weekly data indicates that 16 communities have moved from moderate to low risk status. That's a move in the right direction, and it's good to see. Meanwhile, Holyoke and Hull moved from high to moderate risk categories, and Granby went down under 5 cases, and so they moved into the unshaded white category. Brockton, South Hadley, and Winthrop moved from moderate risk to high risk. Obviously, we're going to see a little movement week over week with a handful of communities who are somewhere near the dividing line between the 2 different categories. But everyone in those high-risk communities, and we've been talking to them pretty regularly, needs to be aware that their community is seeing an extremely high rate of transmission and take appropriate precautions. That means being vigilant about outdoor gatherings and private events. It means wearing a mask and avoiding, to the full extent possible, situations and circumstances where you won't be able to social distance. And obviously, if the contact tracing team calls, they need to pick up the phone and answer it. We are far from not powerless in this fight, and we need to continue to do the things we know we can do that can contain the virus. Overall, compared to the previous 2-week period, 73% of communities had either seen an improvement or no change in their average daily case numbers, and we're glad to see that the vast majority of communities in Massachusetts have not seen an increase in transmission, and that we're seeing positive changes as well in many places. The map featuring comprehensive community-level data is a valuable tool, obviously, as we start to get close to the new school year. As of yesterday's report, 314 of the 351 cities and towns in Massachusetts are reporting an average daily case rate of less than 4 cases per 100,000 or less than 5 cases total in the entire municipality for the past 2 weeks. That means the vast majority of our communities fall into the so-called green and white categories and are experiencing next to no viral spread. Given the low transmission rates in the vast majority of our communities, we're glad that nearly 3/4 of our school districts are using the categories as they plan to either offer a full return or an in-person learning or hybrid approach to their kids. This guidance and the metrics that guide it are based in science. They were developed with our colleagues in the pediatric and infectious disease community, and they're also consistent with ones that are being used in other states and in some countries as well. Commissioner Jeff Riley and his team at the Department of Elementary and Secondary Education work collaboratively with public health experts and medical professionals to follow the science to create these guidelines in the first place that are designed to make sure that we do put our students and our teachers first. These guidelines and the plans recently submitted by school districts are all about the public health measures that we know work: face coverings, hygiene, sanitization, and distancing, which have been in many respects the cornerstones of our efforts and the efforts in many other places to reduce the spread and get to the point where we can start to think about a new normal. The implementation of these safety measures, combined with the low transmission rates we have here in Massachusetts, mean that for most students, and their families, in-person learning is an option that they can pursue. We recognize that new cases of COVID-19 have occurred in people under the age of 18 over the past several months, and there will probably continue to be cases among people under the age of 18 going forward. Preparing for these cases, allocating the resources to respond to them, and doing what we can to prevent them in the first place is why we developed these detailed school opening plans. And until there's a medical breakthrough like a vaccine, COVID will be a part of our lives that we must find a way to deal with accordingly. As we've said before, it's not going away this summer, it won't be going away this fall, but neither is our obligation to do what we need to do for kids here in the Commonwealth, especially when it comes to their social development and their education. It's taken a lot of work and a lot of time and a lot of resources, but school districts across the Commonwealth are following through on that obligation and opening their schools based on intelligent, responsible plans that are driven by the science. To help schools get ready, our administration has provided comprehensive, science-based plans on everything from transportation to sports and, of course, classroom configuration. We've also made available nearly $1 billion in federal funds on top of a modest increase in permanent funding with respect to the state's K-12 funding program, as well as level funding on unrestricted general government aid to cities and towns. And we've worked to develop new community-level data to help guide district decisions. Another resource to assist schools we're making available will be new COVID-19 testing tools that can be made available to every school in the Commonwealth. First, we'll implement a rapid response testing program for K-12 schools across Massachusetts. This program will be designed to quickly deliver testing resources for students and school personnel if there are multiple cases in a cohort that require larger scale testing than a community may have access to currently. This program can be deployed to test students within a particular classroom or other groups. A local health department and the Department of Public Health at the state level will work with a local school district to determine if certain conditions are met and that this program should be deployed. The Department of Public Health and the Department of Elementary and Secondary Education will put out detailed guidance in the coming weeks around how this process will work on the ground. The testing program is not a replacement for necessary testing for students and staff who are symptomatic. As we've been saying for months, if you feel sick with COVID-19 symptoms, you should stay home and you should certainly not go to school or go to work. Students who develop COVID-19 symptoms or are identified as close contacts through contact tracing programs should be tested by their healthcare provider or at a COVID-19 testing site. The Commonwealth is one of a handful of states that's leading the nation in ensuring widespread access to testing resources. There are currently hundreds of test sites across Massachusetts, and thankfully, the average turnaround time for Massachusetts is about 2 days. The weeks-long delays that we've been seeing elsewhere in the country simply are not the norm here in the Commonwealth. The second tool we're announcing is a significant expansion of our Stop the Spread testing initiative. This initiative was launched earlier this summer and currently provides free testing in 20 communities that have high rates of COVID-19. The testing sites made available through the Stop the Spread initiative are open to anyone in the Commonwealth, including people who are asymptomatic. As schools get underway, we want to ensure that we continue to have robust testing capacity, especially in communities that need it the most. That's why we'll continue this Stop the Spread initiative in several communities with the highest rate of COVID through the end of September. As I said earlier, in addition to Stop the Spread testing sites, the Commonwealth has a network of hundreds of testing sites in communities across Massachusetts. You can visit mass.gov/gettested to find a site that's near you. These testing resources for school districts are another tool to keep students and staff safe when kids return to the classroom in the fall. And as with everything that's COVID-related, there is no silver bullet. We must use every tool that's available to continue to contain the virus. Wearing masks, practicing good hygiene, avoiding large groups, maintaining distance whenever possible, testing and tracing. Taken together, the science makes clear that this is how you fight the battle against COVID. And as I said before, it didn't take the summer off, but neither did the people of Massachusetts, and on the whole, we're effectively bringing the fight to the virus, and that's why we've been able to continue to open up businesses and get back, in many respects, to something like a new normal. It won't be taking the fall off, but neither is our responsibility to do everything we can to make sure that our kids continue to thrive. By working together and putting the needs of the children first, the adults can do their jobs and help kids get the education that they deserve. Thanks. And with that, I want to turn it over to Lieutenant Governor, who can talk a little bit more about other back-to-school issues, especially with respect to public health.
Good afternoon, and thank you, Governor. I want to thank everyone from the Massachusetts chapter of the Massachusetts Academy of Pediatrics to the school administrators and educators who helped develop our back-to-school guidance. All of this planning and analysis is a huge undertaking, but putting kids, their education, and their well-being first, front and center, is our obligation. As part of that effort, we announced last week community-by-community metrics, so all schools have reliable information to guide fall reopening decisions. This enhanced data will also advise districts' future decisions should the impact of COVID-19 require transition between educational models throughout the school year. These metrics and corresponding guidance are grounded in science and public health to give schools the best possible measure of what is going on in their own city or town. We are encouraged that approximately 70% of school districts now plan to bring back students to school in September in either a hybrid or in-person model. This data is evidence that our COVID-19 public health guidance and precautionary measures to mitigate the spread of the virus is working. But we still have more to do. COVID-19 will be a part of our lives until there is a vaccine or medical breakthrough, as the Governor stated. So we must continue to take all necessary steps to protect teachers, students, and staff. Yesterday, our administration announced that all Massachusetts school students enrolled in childcare, preschool, K-12, and post-secondary institutions who are ages 6 months or older will be required to receive the flu vaccine. Every year, getting vaccinated is hugely important to our public health, and it is a smart thing to do. We are proud that across the nation, we have the highest immunization for our children and youth, but we can do better. In addition to existing Massachusetts vaccine requirements, students will be expected to receive the flu vaccine by December 31, 2020 for the 2020-2021 influenza season, unless a medical or religious exemption has been provided. Children who are homeschooled are exempt from this requirement. K-12 students in districts and schools learning on a remote model are not exempt from this requirement. College students who will have access to campus for activities or otherwise, despite remote learning models, are also not exempt from this requirement. It's imperative that we get students back into the classrooms, and this vaccine requirement will provide an additional necessary layer of protection for all students returning this year. Many flu symptoms are very similar to those of COVID-19. Given the vigilance everyone is and will be practicing for COVID-19 symptoms, every case of the flu we can prevent helps avoid unnecessary disruptions in learning environments. Additionally, preventing the flu this year will not only save lives, but it will assist our incredible healthcare system preserve resources. Governor Baker, Secretary Sudders, and I know that we have asked a lot of everyone these months, but everyone's work is indeed paying off. Everyone must do their part. But it's critical that we continue to follow the data, set our standards in the best possible science, and help everyone follow the public health guidance to combat COVID-19. Thank you. I'd now like to turn it over to Secretary Sudders.
Governor, Lieutenant Governor, Commissioner Riley, good afternoon. As the Governor mentioned, the Commonwealth continues to make significant progress to increase both our testing capacity and access to testing. This has been a priority of ours since day one of fighting the virus. Testing is widely available in Massachusetts. We have over 250 testing sites, continue to work to expand our testing capacity, and continue to reduce our testing turnaround time for lab results. We're one of the top testers in the nation. Massachusetts is 6th in total tests per capita. Our 7-day average of total molecular tests per 100,000 residents is 391. As the Governor said, the median for the turnaround time is 2 days. Tests taking 6 or more days to be reported into the state's database peaked at 20% of all tests in July, but dropped to 5% currently. Patients usually receive the results before they are reported to the state's database. Like other states across the country, Massachusetts has been impacted by processing delays at some of the large commercial labs. That is why we have been working to expand in-state lab capacity. In May, 43% of tests were being conducted by commercial labs. In August, that number is below 30%. For example, the Broad was conducting about 13% of tests in Massachusetts in May. As of August, that's risen to almost 24%. As the Governor mentioned, to build on this progress to expand access to testing, we are adding the rapid response testing programs for schools as additional support. School officials should always consult with their local public health authorities to determine if requesting a state-sponsored rapid mobile testing unit to test students or staff is warranted. The mobile response team would be deployed if the following minimal conditions applied. For example, if 2 or more students or staff within a classroom group develop COVID within a 14-day period and transmission exposure appeared to have occurred in the classroom. If more than 3% of the cohort or grade, which means at least 3 individuals, developed COVID-19 within 14 days. If more than 3% of the school develops COVID-19 within 14 days and there's evidence of transmission within the school. If 3 or more staff within the same school develop COVID-19 within that 14-day period and there's evidence of transmission among staff. And if 2 or more students on the bus develop COVID-19 within 14 days. As the Governor said, the Departments of Public Health and Elementary and Secondary Education will share more detailed guidance soon. I would also like to share some information on a planned system upgrade to the Department of Public Health data system that will occur this weekend. DPH will be making a long-planned transition of its data systems portal from a DPH server to the Amazon Web Services cloud. Moving to the cloud will help handle dramatic increases in anticipated testing volume as well as other data, which is particularly important now as we anticipate rapid increase in COVID testing volumes as more students return to Massachusetts colleges and universities. Migrating to the cloud is one of a number of planned technological systems upgrades to strengthen Maven and other DPH reporting systems. On this Friday night, there will be a temporary shutdown of the portal or pipeline through which lab results are reported into Maven, which is, as you know, the state's disease surveillance and case management system. This means that our Saturday report, which usually includes testing results received into Maven between 8 a.m. Friday and 8 a.m. Saturday, may suggest lower testing numbers. That report will be issued. As a result of the system shutdown, however, no dashboard will be published on Sunday, August 23rd. Monday, August 24th daily dashboard will include all the lab results from the weekend. Test volumes and results will be appropriately assigned to the respective test dates, as usual. Throughout the weekend, all of the existing data in Maven will be accessible by DPH epidemiologists and local public health departments, but no lab results will be added during the migration period. I have a team of epidemiology staff as well as technological staff on the job all weekend with every 4-hour updates to everyone up to and including me. Once the migration is complete, which is anticipated to be early Sunday morning, all of the new lab data will be imported. The timing of the migration was planned specifically for a summer weekend to minimize any impact on daily operations. The migration to the cloud is a needed upgrade that will result in a number of systems improvements, including increasing the current daily volume of test results, processing from 25,000 test results to anticipated more than 100,000. Incorporating an electronic quality assurance dashboard to monitor data flows and errors, a process that currently is done manually. And providing additional capacity on the server, making more report enhancements possible. Our commitment is to provide accurate, timely, and transparent data for everyone, from researchers to the public at large. As you know, each Wednesday, in addition to the daily dashboard, the department publishes a weekly public health report that includes the town-by-town level data on COVID, updates on contact tracing, and results of nursing home surveys, amongst many other data points. This data set has grown over time, and with the amount of data that must be gathered from several data sources, organized and quality checked for each Wednesday's report, it's become increasingly difficult to meet the 4 p.m. self-imposed deadline. I know this because we get pinged by some of you in this room. So starting next week, the weekly public health report and the daily dashboard on Wednesdays, and only for Wednesday, will be posted no later than 6 p.m. Every other day, it will be posted by 4. Thank you. Governor?
Questions?
Governor, I wanted to ask you about this MGH study that was released overnight that shows children may be playing a large role in spreading the virus. And given that study, though it was one study, it does seem as though the science on this whole thing involving children is still a little bit unsettled. So I wonder if that gives you pause about pushing so hard for in-person learning.
So first of all, one of the things I've said from this podium, and so has the Lieutenant Governor and the Secretary, is that the knowledge base around COVID is one that continues to evolve. And in some cases, it runs in exactly the opposite directions within a week or two. For example, there was a study that was put out about 2 weeks ago that got a lot of attention that said gaiters were not effective, or were not as effective as face coverings. A week later, there was a study that came out that said gaiters, in fact, were as effective as face coverings. I think the message that we took from all that is if you hold it up to the light and you can see through it, it's probably not very effective. There were studies about whether there was asymptomatic spread or not that went on for months until people finally landed on the idea that it's pretty clear there's asymptomatic spread, and then there's some debate about whether it's 20% of the cases or 40% of the cases. And one of the biggest areas of debate and discussion has been how much of the asymptomatic spread involves kids. When I say kids in this case, I mean sort of anybody under the age of 30. I think from our point of view, one of the reasons why we spent so much time with the infectious disease community and the pediatric community in developing our criteria and our guidelines with respect to school reopenings was because of concerns that some of this data is still evolving and we don't always know the answer. And that's why the rules around transportation, the rules around distancing, the rules around desk configurations, the rules around masks, the rules around sort of all the elements associated with in-person learning were worked on pretty hard and developed with a pretty broad panel of experts before we put it forward. The other thing I would say is that if you have a commonwealth in which you have 351 cities and towns and 300 of them basically don't have a heck of a lot of COVID, there can be a fair amount of confidence in those communities that a hybrid model or some version of hybrid plus in person can be a workable model that can be done safely.
Governor, can you explain on the rapid mobile testing, how will that be launched in the schools, and then how will the...
It would actually be launched, it wouldn't be launched in the schools. It would be a real resource that would be available to the schools based on some of the criteria that the Secretary walked through.
And how would contact tracing work within the school? Would it be the same way? Would they, the same parameters, kind of, 15 minutes, 6 feet? and then try to keep kids out of the school if they become contact traced?
You mean as close contacts?
Yeah.
I think
How will the contact tracing be done in the school?
I think it's going to be done the same way it's done now, which is the outreach would be to the family or the individual who tested positive, and then the follow-up would be with any of their close contacts, who could be kids in school, but who could also be, you know, the kid who came over and watched the movie who lives next door. I mean, there's a lot of other possibilities there, but the model would basically be the same.
So will schools have to request the rapid mobile testing program to like deploy to their school? And also, you said K through 12, are you looking at this for colleges to be able to access as well?
I think we're thinking mostly about K through 12 on this. The colleges, I think, have their own expectations about being able to use their own health services for that type of stuff. And many of them have signed up with the Contract Tracing Collaborative and with the local boards of health to do the work for them associated with tracing cases in colleges. With respect to the mobile testing, the mobile testing capacity itself would basically be ordered by the local Department of Public Health in the district in which the school was located.
And would kids get tested before they then proceed into school, or is this something, because it is 15 minutes, I'm just kind of trying to figure out how it would work, what it would look like.
You want to speak to that?
So as you know, the CDC does not recommend testing for students and staff. So we see this as a response to schools concerned about cluster development. And so if a couple of, so I'm just going to, let me just say like 2 teachers, are a teacher and a student in a classroom, both within a 14-day period, were to become symptomatic with COVID and tested positive, that the local Department of Public Health, the local Board of Health, and the school could say, we're concerned that this classroom may have transmission going on, and they could request the rapid response team to come to the school. Obviously, if for students to be tested who are in that classroom, parents would have to agree, right? You have to have written consent of parents, but we'd make it available for schools to have testing done. We see it as sort of an abundance of caution of being able to do, just like we do now, we have stopped the spread in 20 communities. Anyone who's asymptomatic, right, can go be tested. So we see this as a response to school concern that they might have a cluster in development within the school, within a cohort in a classroom, among teachers, or a couple of kids on a bus. So we see this as a way to deploy, right, just like we did on nursing homes. All right, we come to you in the event that you believe you have a cluster, and obviously everybody who has a runny nose, right, we're not going to come out. So there has to be some parameters involved, which is why DESE and the Department of Public Health will put out some greater guidance on sort of how to request this. But we will have the capacity by the end of August of a statewide mobile response team. The RFR is active right now, and there's been a lot of interest, just like when we tested it out on the nursing home side. So it's that kind of being able to come to the school in response to concern. And the cluster is defined as 2 or more non-related individuals within some kind of contained
Are you
space.
concerned about accuracy, though? There was reports that there were some false negatives with these, and you should take...
So this is PCR testing. So, right, this is diagnostic testing. This is molecular testing. This is not, I'm looking forward to when we have true surveillance ability in the Commonwealth of Massachusetts.
Secretary, can you,
Governor, you may have heard the teachers' unions were rallying out front here yesterday. I don't know if you were here. They are saying they may refuse to go back to school because it's unsafe and it's putting their membership lives in danger. Are you concerned that towns may have to hire replacement teachers if they don't go back?
Well, I'd say 2 things about this. One is the guidelines and the criteria that we developed in conjunction with, which actually mostly developed by the folks over here, the command center and the folks at DESE. That work was done in conjunction with epidemiologists, infectious disease specialists, and the pediatric community. And that's why the American Academy of Pediatricians here in Massachusetts endorsed our proposals. I think in many ways, people are using what I would describe as the best science to develop appropriate plans and standards to implement this. And And I think it's anticipated and expected that, that people will teach. I mean, do you want to speak to this question, Commissioner? I mean, it seems to us that based on the dialogue and the vibe that we've gotten, you know, there's always going to be some back and forth, because there always is, over any kind of change in criteria associated with sort of the opening of the school year every year. But I think it's our expectation, especially in those communities that really don't have a heck of a lot of COVID at all, and where the rules and the guidance around hybrid and in-person learning are pretty well developed and have actually been in place in other countries, in many cases for a significant period of time with limited impact, that this shouldn't be an issue for people.
They're saying that they want routine testing in the schools, non-emergency testing, rapid response, and they want every school building certified as safe by the state, grade fees, HVAC, etc.
So I would urge everybody to take a look at the statement that was issued by the Amherst-Pelham School Committee in response to the demands of the teachers union and their community. They make a very strong case that the guidance, criteria, working environment, all the rest of the elements that they put forward were completely consistent with the science and advice and guidance that's been issued by the national players in this space, as well as in some cases the global players, and that some of the issues that were being raised by the union just don't even make any sense. I think in many ways, I respect and understand the importance of making sure that this be done safely, but I would also ask people to respect the science, which at this point is developing a fairly decent body of evidence with respect to what works and what doesn't when it comes to teaching in person. I mean, we've had special ed schools that have continued to teach all the way through this, and we visited a few of them, and kids are wearing masks, instructors are wearing masks, and the programs are basically working, and they've been working, and they involve a lot of close contact when you're talking about special education. This can be done, and as I've said before, you know, we need to commit to the science. We believe we have, but we also need to commit to the kids. One of the reasons that so many people in the mental health and pediatric community are deeply concerned about this continued approach to remote learning, which in many cases last spring, I think everybody would agree was really not learning at all, is a really big issue. And it's one that we need to incorporate into the way we think about the health and safety of kids generally.
Governor, I wanted to ask you about the flu vaccine, your decision to go ahead and make sure all kids get it. And I wonder if you worry about a flurry of exemptions coming in as well.
I think look, there are three issues here around flu. The first is last year, when COVID really landed here in a big way, it was basically toward the end of March, the beginning of April, which meant it came literally right after the flu season. Now, there's some debate about how much of what took place that people might have thought was the flu in January and February, but there's no question that on a typical year, we have, what, 40,000 cases of flu? 55,000 emergency department business and 8,000 hospital admissions. I think it's really incumbent on us to do what we can to try to limit the number of hospital admissions and the number of cases we have this year. Because if there is an echo associated with COVID, it'd be really nice to not have all of our medical personnel trying to separate what in fact is flu from what is COVID, and then dealing with the consequences of having both of those things happen in the hospital system at the same time. Now, we currently have about an 81% positive test rate, an 81% get the vaccine rate for students here in Massachusetts, K through 12. I think our view on it is pushing that number up higher would be a good thing. Getting the college kids to play in this space would be a good thing. And the federal government bought a ton of extra flu vaccine this year, specifically because they would like to see states work to enhance and extend the number of people who actually get the flu shot. the exemptions are there. We made perfectly clear that the exemptions are there. Medical exemptions and religious exemptions are there. I would expect that we would probably see more because we're encouraging more people to get tested. But I would hope people understand that this is an important part of how we continue to fight the virus here in Massachusetts. The more people who get the flu shot and don't get the flu and don't end up in the ER and don't get the flu and don't end up in the hospital, the more capacity we'll have to actually serve the people who do have COVID, and more importantly, the work associated with trying to figure out what exactly someone's issues and circumstances are for clinicians would be dramatically improved as well.
Governor, is the flu shot requirement for this year solely, or is that permanent for every school year going forward?
It's this year.
You mentioned two-day testing turnaround. We're doing something different in the western part of the state. Is there anything being done to improve that out there?
Do you know anything about what's specific to the western part of the state? Okay. If I got it wrong, Secretary, tell him I got it wrong.
I would never say the governor got anything wrong. Just to clarify that the flu guidance is actually not just this year. It's on a going forward basis.
It was for testing turnaround.
No, I know that, but someone asked about the flu. Right, I'm sorry.
So it's permanent.
It is, it is going forward. Yes, not just this year. The turnaround. So 75% is less than 6 days. There is no question there, and about 5% of tests are 6 days or more. We have two proposals. We put out an RFR to increase in-state lab capacity, and the requirement is you have to also ensure turnaround in a short period of time. And we will be making announcements next week, and there are several proposals from Western Mass. So we expect to be able, we should be able to announce something next week. Obviously, it's an open procurement. But the reason we did this open procurement to increase lab capacity was to increase lab capacity in state and to further drive down the testing result rates. And you can see that from July into August when we actually increased the Broad capacity, also drove down the test result turnaround.
And that's something you're expecting to keep going?
Yeah, absolutely, yes.
Governor, any other strategies for the North Shore cluster so we can get these kids back to where they yeah.
So there are a number of, obviously we're talking to all the communities up there and working on plans that are specific for each of them. And I think that's going to be the most effective approach, but they're going to involve messaging and more testing capacity as well, and a pretty big dose of support for local communities around managing informal gatherings and that type of thing as well.
Can Commissioner Riley
A
speak?
lot of the districts that are going hybrid are only bringing back a small sliver of their students, like kindergartners or only special ed students. Do you consider that hybrid, and also does that satisfy you in bringing the kids back into the classrooms in those districts?
School year is going to last hopefully 8 or 10 months, and I think over the course of that period of time, the facts on the ground are going to drive how much time people spend in a hybrid, how much time they spend in a remote model, how much time they spend in a fully in-person model, and what grades and which clusters of kids are associated with that. I think from our point of view, the most important thing is to get people comfortable with the idea that they can, especially if they're in those 300 plus communities that have very limited COVID exposure in the first place, that they can find a way to make this happen in school. And part of the reason why the commissioner asked folks to develop 3 plans to begin with, an in-person plan, a hybrid plan, and a remote plan, was because he believed that at some point during the year, depending upon circumstances, a particular school or a particular grade or a particular group of kids might have to be served in a different model than the one that was being used generally across the rest of the school district. And I think from our point of view, the goal here should be to try to have as many kids as we possibly can safely being educated in a way that works for them. One of the things I said at a previous event here was teaching kids how to read remotely is not something I'm aware has ever been done particularly successfully. And it's very important that kids learn how to read. And I think many kids and many families, and probably a lot of other folks in education, would say that the experience people had with remote learning last spring was not very good. I would certainly hope the experience this year will be significantly better if school districts open remote. And for those that might have to go remote over the course of the year because of something happens with respect to COVID in their communities or some other issue. But I think it's important that people recognize that this is going to require a certain amount of discipline on everybody's part with respect to abiding by the guidance and the rules that have been established, and a little bit of nimbleness to be able to deal with the facts on the ground as they play out. But I don't think we should go into this with an assumption that it can't be done, because it is being done in so many places around the world using a lot of these same guidance, policies, and procedures. And we do owe it to our kids to help them make sure that they get back into the routine of school in a way that works for them and works for the people who are teaching them.
Governor, have you seen any more, have you heard about any more big house parties since you put those crowd size limits in effect? And has the state issued any fines since then?
The fines, for the most part, are more likely to be issued by the locals than they are to be issued by us. I think we'll have more to say about that in about a week.
So you have heard.
We'll have more to say about it in a few days.
Brockton is asking for help. They say
Yeah.
they're having out-of-control parties. Can you speak
Lieutenant
to-
Governor's talked to the mayor. Tom Turco, our Secretary of Public Safety, has talked to the police chief. We're going to be very helpful to Brockton in dealing with some of their issues around parties generally, which the mayor has raised as a significant issue.
When you say helpful, like, is it more patrols or enforcement, or what does that look like?
Both. I mean, it could be, I mean, it's going to be a variety of approaches. Some of it will have to do with, manpower, human power on the ground to help them with this. But some of it's also about guidance with respect to how to actually, do the stuff associated with issuing citations around non-mask wearing and that type of thing, and large gatherings that don't abide by any of the rules or the criteria associated with the orders that we've issued previously and this stuff.
Can the Lieutenant Governor speak at all to the decision not to allow fans at Gillette that happened pretty soon after we last had a press conference here? Just sort of the reasoning for that, and do you anticipate being able to have fans in the stands at all?
Yes, as part of the reopening process, we do listen to the various stakeholders who present their plans. We even can reconsider as time has gone on and conditions have changed, certain aspects of reopening a particular business or activity. In this case, both Fenway and the Gillette groups presented plans to us. With regard to Fenway, their season being much more limited, being one from now through the end of September, directly coincides with the return to school and the return of many kids back to college campuses, and it didn't seem appropriate for us to allow for that venue to be occupied with fans. Relative to Gillette, their season, at least relative to the football team, is longer in duration, but also considering the return to school and getting kids back onto campuses, we are not allowing fans through September, but we would be willing to look at the opportunity in the future, depending on what the circumstances are. But there are a lot of factors that go into that. We're very pleased to see live games. It was really fun to see the Bruins and Celtics play yesterday, and I've heard from a lot of people that it's really feels normal to see a game that you don't know the ending to. Having fans in the stand is a whole different game, and we'll continue to monitor that. We very much appreciate the professionalism of the Gillette and the Patriots team, the Revolutions, and the Red Sox, just really doing a great job in trying to manage through difficult circumstances. They've been a really great partner with us.
Thank you. Governor, have you caught any of the DNC at all? Have you been watching?
I haven't watched it. I was watching the Bruins and the Celtics.